What does vitamin D do?
It's hard to think of a health condition that isn't impacted by our vitamin D levels. Having sufficient vitamin D decreases our risk of at least 11 different health condition types. I mean, like cardiovascular disease, autoimmune disease, cancer. So let's zoom in on just three of them. Let's look at bone health, colorectal cancer risk, and risk of type 2 diabetes. Vitamin D is important for regulating our calcium levels. And in general, studies show that adequate vitamin D and calcium is really important for reducing risk of osteoporosis and bone fracture. For example, a 2022 meta-analysis showed that a daily dose of vitamin D between 800 and 1,000 IU in older adults reduces the risk of falling by 19% and the reduce of fracturing a bone by 13%. Adequate vitamin D reduces the risk of several forms of cancer. And for example, a 2023 study that compared vitamin D sufficiency with vitamin D deficiency showed that that decreased the risk of colorectal cancer by 69%. And of course, the link between vitamin D and type 2 diabetes is one that I go into in detail in my book, Nutrivore. And in a 2017 meta-analysis, people with higher levels of vitamin D had a 34% reduced risk of developing type 2 diabetes compared to people with lower levels. And a 2012 study showed that in people with prediabetes, risk of progressing to type 2 diabetes decreases by 25% for every 4 nanogram per milliliter increase in serum vitamin D levels. Now, while 30 nanograms per milliliter is considered a normal vitamin D level, most scientists agree that between 50 and 70 nanograms per milliliter is optimal. And with vitamin D, it's really important to test, not guess. So get your levels tested, get a recommendation for a vitamin D supplement directly from your doctor, and then retest in 3 to 6 months to make sure you're getting enough to get your levels into that optimal range and that you're not taking so much vitamin D that you're overshooting the mark.